Hello all, my name is Nicole Uggan and I am here to discuss the possible drug treatment to treat depression. Before we can talk about depression and the possible drug treatment, it's important to understand the neurotransmitter theory involved with depression, which is the neurogenic theory of depression. According to Advocate Kamadi and Julian, the theory of neurogenic depression shows that neurons can repair and remodel themselves and the brain can make new neurons. Neurons are made within the hippocampus and frontal cortex, and the hippocampus is also vulnerable to trauma, like infections or lack of oxygen. The hippocampus plays a huge role in many of the depressive disorder symptoms like attention, memory, and concentration. When damaged, it can cause depressive and unfortunate symptoms. Trauma to the hippocampus can also be due to stressful situations. During stressful situations, the hormone cortisol is released and the nerve cells of the hippocampus is reduced. In addition, the protein CAMP, response element binding protein, or CREB, binds and sends messages in the hippocampus and activates the brain-derived neurotrophic factor, or BDNF, which is a protein important in healthy neuron growth. BDNF helps protect neurons and unfortunately, experiences of stress decreases BDNF. Antidepressant drugs can help reverse the hippocampal shrinkage and help increase or prevent the reduction of BDNF seen within depressed individuals. Moreover, there are several drugs that help treat depression. However, the most commonly used drug for depression is the serotonin reuptake inhibitors, or SSRIs. Some of those include Prozac or fluoxetine or Zoloft sertraline. The SSRI is a drug designed to block presynaptic transporters of serotonin reuptakes. Some risk of taking these drugs include serotonin syndrome, SSRI discontinuation syndrome, and SSRI-induced sexual dysfunctions. Serotonin syndrome is the accumulation of serotonin that can cause cognitive disorientation, confusion, or hypomania. SSRI discontinuation syndrome presents Finnish symptoms, which is like insomnia, nausea, imbalance, sensory disturbances, and hyperactivity. SSRI-induced sexual dysfunction presents symptoms like ejaculatory dysfunction, erection, sexual interest desires, and physiological arousal. Now, according to NCBI, there are benefits to include reduced risk of toxicity, low anticholinergic effects. Dosages can be flexible with different varieties of SSRIs, and there are age-related changes in the plasma levels. Out of all the other treatments for depression, SSRIs are the safer medication that causes fewer side effects. It can also help with different disorders like obsessive-compulsive disorders, panic disorders, or social phobia. In the end, benefits depend on the severity of the depression. The more severe and extreme the depression, the more benefits a person will receive from this medication. Some of the successes, according to NCBI again, in a study of 100 people taking either the placebo or the actual antidepressant pill, showed that 20 out of 100 individuals experienced reduced symptoms within 1 year. Another study, according to NCBI, with individuals or 100 people taking the SSRIs, 27 out of 100 people successfully prevented relapse, which is a good thing. On the other hand, some side effects of taking this can also include different things from suicide to physiological symptoms. The younger a person is, the more likely to commit suicide. Sleep disturbance, interference with sleep function, and it may also produce insomnia. Apathy may also occur and includes a lack of motivation to complete work. Some physiological symptoms include nausea, headache, lethargy, muscle cramps, seizures, coma, or respiratory problems. In all, the SRI antidepressant pills have both risk and benefits. It can help relieve long-term depression and go away completely, and it can have positive effects within 1 to 2 weeks. However, symptoms may take a while to improve. Finally, the rate of illness is in that neurotransmitters will be inhibited, and the individual will experience more symptoms of stress and hinder the CNS systems, hippocampus, and other parts that promote depression. The natural course of illness is that the individual will experience depression and extreme sadness if they do not take the pill. They may also experience isolation, fear, and loneliness. Now, the rate of spontaneous recovery is that recovery can take anywhere from several months to several years, depending on the severity of the depression. A person with chronic depression will have a longer time for recovery than a person with mild depression. Now, the rate of mortality will also be on the rise. Other forms of therapy include cognitive-based therapy, acupuncture, or basic exercise routines to help relieve stress and remove depression from the picture. It is important for an individual to take some sort of therapy to rebuild the CNS system that affect depression and help completely reform the person to become a happier individual. Now, thank you, and I hope this helps inform you a little bit about depression and the possible drug treatments. Here are my references.